Interdisciplinary Plan Assignment by Luke Minturn. So first to start out with the description of the role of each discipline. The main role of the occupational therapist when referring to Pamela would be to return her to being fully independent in her ADLs and IADLs that she has stated she has difficulty with, which are dressing, bathing, self-feeding, and hygiene and grooming tasks. This will be accomplished by occupational therapy through having Pamela participate in those occupations that she stated, and then making adjustments to them as needed based on her occupational performance during intervention, and then as well as having her participate in any other meaningful occupations that she identifies with you as the occupational therapist. In doing this, not only is she getting to participate in those meaningful occupations in her life, other areas that Pamela has deficits in will also be addressed, such as deficits in her strength, endurance, functional mobility, transferring, and then just navigating her various environments. When referring to physical therapy, the main role of a PT would be focusing on functional mobility, lower body strengthening, and balance. When referring to Pamela, physical therapists provide interventions related to movement dysfunction to promote a person's ability to move, restore functional abilities, minimize disability, and decrease pain. More specifically, PTs are trained in body mechanics and how various systems of the body are affected by motion, positioning, and exercise. In regard to Pamela, they will likely focus on her deficits in lower extremity strength, ability to ambulate with a four-wheeled walker, transfers, deficits in balance, and decreasing her pain. The main role of the speech therapist when referring to Pamela would be to focus on her dysphagia that she's experiencing for the past three months. The speech therapist will determine if Pamela is in a functional position when eating and drinking, as well as possibly making any recommendations when it comes to adjusting textures and viscosity of foods and liquids that she will consume to help decrease that dysphagia. When trying to determine if one discipline is more relevant to Pamela than the other, I would say there really isn't one that is more important than the other. Pamela has a lot of unique needs, and because of this, she would benefit greatly from receiving OT, PT, and ST. And receiving all of these skilled therapies will likely optimize Pamela's outcomes and return her to a greater level of independence when she leaves acute care. Moving on to intervention and treatment plans for occupational therapy. Since Pamela is in the acute care setting and the next stop for her will likely be at a rehabilitation facility, the main focus of treatment sessions will be her identified ADLs that she's currently unable to do without the help of her husband, which are again dressing, bathing, self-feeding, hygiene, and grooming tasks. Interventions will likely involve Pamela participating in these activities in different environments, like at the edge of her bed, at the sink, on the toilet, in order to increase her independence in these areas, as well as increase her musculoskeletal strength and endurance. Significance will also be placed on safety techniques, energy conservation techniques, and the use of adaptive equipment if necessary during intervention. Just some simple ways to upgrade and downgrade grooming tasks, let's say at the sink, having Pamela stand at the edge of the sink if sitting is too easy for her, having her stand, challenging her endurance in her lower body, and then just opposite of that, if it's too difficult for her to stand, having her sit in her wheelchair at the edge of the sink, having her participate in that, or even just having her participate in those grooming and hygiene activities at the edge of bed rather than having her transfer to the sink. Some interventions for physical therapy will have a large focus on regaining Pamela's deficits in mobility, balance, and general weakness as a result of her chemotherapy. Interventions include having Pamela participate in walking up and down hallways of the hospital and marking the distance she's walked to determine progress in that area. This will also help to increase strength and endurance in her mobility. Also having her participate in lower extremity exercises with the use of bands or ankle weights to increase strength and endurance as well. And then also practicing walking up and down steps to simulate steps in her house. Significance will be placed on maintaining proper body mechanics and safety throughout interventions. Just some easy ways to upgrade and downgrade interventions for physical therapy would be reducing the amount of distance that she has to walk in the hallways in order to, I can't remember if I said increase or decrease, but either way, to upgrade or downgrade, increase or decrease the amount of distance that she has to walk through the hallway. So when referring to speech therapy, they will likely focus on interventions involving swallowing foods and liquids. Interventions include things like determining the proper thickness, consistency of Pamela's food and liquids to ensure that she doesn't choke. Speech therapists can also introduce different textured foods and drinks that Pamela can consume without having to worry about choking on them. I think the speech therapist will focus a lot on educating Pamela on different foods that may be difficult for her to swallow at first, and also focusing on teaching her how to swallow properly. If she ever does choke, just giving her different techniques to help get the food down a little easier or liquid down. And then just general safety concerns when eating and drinking. Speech therapy will likely address those. Different examples of co-treatments when thinking about occupational therapists working with physical therapists. I think of them, working in the home environment with Pamela more, working together to identify placements of grab bars throughout the home, modifications to doorways, whether or not stairs may be an option for Pamela, and then also determining proper durable medical equipment that would benefit Pamela. Overlapping goals in PT and OT could be something like working with Pamela to help her navigate her environment in a safe and efficient manner. And then occupational therapists can also work with speech therapists in the realm of eating and drinking. OTs can work with STs to help Pamela manipulate her feeding utensils by adding straps to the utensils or building up the handles, help make that a little easier for her. And that would also be an area, the area of utensil management would be, I think, where one might see an overlapping goal between occupational therapy and speech therapy, both of them focusing on proper use of utensils when eating. Let's see here. And then finally, communication. It will be very important to be constantly communicating with others who are involved in Pamela's care, whether it be speech therapy, physical therapy, nursing, family, doctors, in order to provide the best care possible for Pamela. By constantly communicating with those providing care for her, the interdisciplinary team as a whole is able to stay up to date more on her health status and then plan their interventions accordingly so that she's getting the most out of her time in the acute care setting. It will be important to always check in with the nursing staff prior to seeing Pamela to see how her night went, how her morning's going, seeing if anything has changed lately that may affect your therapy sessions. Communicating with PT and ST will be important to, again, make sure you're providing Pamela with interventions that are going to be just most beneficial for her, making sure that the three of you aren't overlapping too much so that she's just getting the most out of her time there in acute care, focusing on many different areas. This communication can be done through face-to-face communication or by reading the progress notes of those other disciplines. And finally, I believe maintaining an open line of communication with family will also be very important. I would welcome all of them into Pamela's sessions and answer any questions when appropriate that they might have on her progress. So that is it.